The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting group. Access Fort Wayne is a department of the Allen County Public Library. If you or anyone you know might be interested in making a television show, please call 260-421-1250.
Hi, welcome to the show. This is going to be very interesting and help you a great deal. So be sure to watch it. It will, within a few days, we'll go to YouTube. You can watch it there again. And the name of the show is Insulin Test. Let's get on the road. Insulin Test. In this video, I will just and this will be go to podcast too. I will discuss the physiology and science of insulin in great detail. You heard about it, but you're going to know a lot about it. The subject of diabetes will also be discussed in great detail, since it causes, would you believe this, diabetes, which causes 57 diseases. Yes. In my videos today and others, you can look at in the past, will teach you how to prevent it, stop it, and reverse it. Good news. And then could be largely prevented, stopped, or reversed. I'm declaring war on diabetes. I've even written books on it. Previous shows you can see on YouTube. I will be speaking about a great opportunity, and we need to join hands and get the job done. Yes. I've tried hard. Like this is a musical town, and I spoke to the person largely responsible for that the other day and begged him to join me in his fight. But he was not interested. But I'm not going to allow you to have 57 diseases. They can be prevented, and it's easy. Okay, let's get on the road. This book I have here, I want you to look at that. Joseph Kraft, MD, MS, FCAP, said many years ago, quote, should everyone be tested for insulin? Yeah. Which, absolutely not. Only those concerned about their future. You're concerned about your future. I'm concerned about your future. And I have the information to get you to change it. I will present the science he used and eventually wrote a book about it. This is the book. This is the book. Certainly, if you can go to Amazon and get a hold of the book, or that would be helpful too. But once you listen to this today, you may not need to do that. Dr. Kraft said normal fasting blood sugar, okay, normal weight, okay, does not exclude you from being type 2 diabetic. Mm-hmm. Yes. You also need a serum insulin to complete the proper testing. And we're not doing that, but I'm going to teach you today to ask for it. He proved it scientifically, and we will present that science that he used. Joseph Kraft was chairman of the Department of Clinical Pathology. He was a pathologist and nuclear medicine. Now that's different. He was certified to use nuclear medicine at St. Joe Hospital in Chicago, Illinois. And he was in charge there 35 years. 35 years, very experienced individual. Following additional training, he was a pathologist, okay? He looked at the bottom line. What diseases do you have? Or at the Oak Ridge Institute of Nuclear Medicine, that was located in Chicago. It's not everywhere, but it was close to his office. So he trained in nuclear medicine besides being a pathologist. He became certified by the American Board of Nuclear Medicine. Yes, many years ago. Dr. Kraft then did 14,384 oral glucose tolerance tests where you swallow some sugar and they check your blood sugars with insulin assay. And that's what I'm here to teach you today about insulin. And he did it in people from ages 3 to 90. So he studied children too. Dr. Kraft said, approaching the problem of diabetes, of heart disease, atherosclerosis, hypertension, at age 60, I'm only 90, has far less potential of prevention than at age 10 or 15 or younger. Prospective management of atherosclerosis from diabetes must be directed to childhood when the therapeutic potential is the greatest. If we go to study the chemistry and the insulin in very young children, we can save them a lot of diseases. That's what I'm about today. They found that middle schools are appropriate targets to reduce diabetes risk. We should be studying children at a very young age, even as early as age 3, running serum insulins on them. Hyperinsulinemia, where insulin levels are high, hyper, where they are high, is the major risk factor for type 2 diabetes in the young. So if we are testing the children, we can see that the insulin is elevated, corrected by proper nutrition, and we wouldn't have all these diabetics we have throughout the world. Remember, diabetes causes 57 diseases. I can name them all, from dementia to heart attacks to strokes. I could go through all of them. It was found that serum insulin could be elevated 10 to 15 years before the blood sugar went up. That's the interesting part. If we're testing for the incidence before the sugar goes up and causes all its damage, and the diagnosis of diabetes was made. But while the blood sugar was normal, I have a normal blood sugar, I'm not diabetic. Well, that doesn't tell me anything. We need a serum insulin too. The elevated serum insulin is causing great damage in the body. I'm not diabetic, but it is silently causing a great amount of disease because the insulin makes holes in the vasculature, causing disease without symptoms, as I mentioned. So in the Vietnamese War, Korean War, the soldiers that were killed, they did autopsies on them, and they found that the Vietnamese, Koreans were disease-free, their bodies. But the Americans, although not symptomatic for disease that was in their body, had very abnormal autopsies. That really proved the point. So testing for serum insulin is critical to catch people early, save their lives by reversing vascular disease. Without the insulin assay starting at age 3, remember that, starting at age 3, an impact on the diabetes pandemic will not begin. There's a pandemic across the world of diabetes. It's in many countries. Insulin stimulates and causes the arterial smooth muscle proliferation in the blood vessels. And lipid synthesis, that's what in the arterial wall. Dr. Stout investigated this around the 1970s, and he revealed that hyperinsulinemia, elevated insulin, produced an effect on arterial vessels, including capillaries, the small vessels, have now been identified with the endothelium of the arteries. It's the innermost layer, the endo, inside the vessel. And called endothelial dysfunction. The endothelium is the innermost single layer of cells lining the capillaries. Capillaries being the small vessels. The innermost layer is called the endothelium. In all arterial vessels, in the distribution of capillaries throughout the body, accounts for the microangiography, the microvessels of the retina, of the eye, the filtering system of the kidneys, glomeruli of the kidneys, and the interstitial myocardium in the heart, and the neurootology of the internal nervous system. So the hearing vessels are very small, so they're affected too. The pathology, that means the disease state of diabetes is vascular. You're a diabetic. Vascular disease is your future. But it can be prevented easily. Look at my TV shows, YouTube shows. You can get rid of it. You can prevent, reverse diabetes easily. Diabetes causes 57 diseases. And I don't want you to have them. All major arteries and all minor arteries and all capillaries are lined by thin epithelium called endothelium. It's the innermost layer of the blood vessels. Every organ has potential for pathologies. Every organ in your body has potential for disease. Remember I said diabetes causes 57 diseases that can be prevented or reversed. There's one specific lesion upon microscopy, looking with the microscope, examination and definition for diabetes. It's the intercapillary glomerulo, those are the filters of the kidney. This occurs in type 2 diabetes of long duration. You can see the vasculature involved in the kidneys. The pathology, again, the diseases of type 2 diabetes, of type 1 diabetes is also vasculature, because they're receiving insulin. Remember I said insulin punches holes in your arteries. So type 1 diabetics, who you have to give insulin for them to survive, get disease. Cardiovascular disease complications are the leading cause of morbidity and mortality in people with diabetes. So that's a disease that I want to prevent, stop, or reverse. My city here probably is 80% diabetic. If we were testing all the people with serum insulins, well, the sugar's still normal, we would be identifying them very early. And we are not doing that. And I can't seem to get the health system interested. I even talked last night to the gentleman who's leading us in music in the city. All the buildings, musical buildings, he frankly is responsible for. I tried to get him to switch and look and help me, but he said it's too complicated. Well, we may have a musical city, but we have a very sick city, and it's that way across the world. Mm-hmm. Cause of morbidity, mortality in people with diabetes. Diabetes increases the development of cardiovascular disease 5-fold. 5 times. That's why I want to prevent it. as many as 80% of patients with type 2 diabetes die from cardiovascular complications in the world population. That's how, diabetes causes 57 diseases. You can see that wouldn't be hard to come up with. There are millions of undiagnosed pre-diabetics before their blood sugar goes up with normal fasting or impaired glucose. The blood sugar is normal, okay? The majority have elevated serum insulin levels and could be diagnosed much sooner. So it would be important to get the insulin test. Insulin can be good and bad. The type 1 needs it to stay alive, so we give them insulin. The type 2 can be declared, but can be helped, but also the insulin starts the arteriosclerotic process. It punches a hole in the innermost layer of our blood vessels, except the veins. The veins are not involved. Patients who have less insulin have less vascular disease. So that's the reason we want to know the insulin level, so we can act on it to get it down. We are not testing for serum insulin, means blood insulin. So I want you to know what is your insulin level. You say to me, I'm not diabetic. I will say, did you have, what's your serum insulin? If you've not had that test, I don't know if you're diabetic or not. We're missing more than 50% of the type 2 diabetics, early ones that we know about. A huge lost opportunity. Dr. Kraft, remember, he has this book, says we should test children starting at age 3. I agree. We need to test children at age 3. But most doctors don't know about that. The hospitals, I think, do know about it, but they don't want you to do it because those kids may not get sick, and they'd be treating less people and making less money. Put the information of testing on a spreadsheet, a book, or computer, our insulin level. We will be diagnosing diseases at a very early age and be able to stop the disease very quickly. That's my goal. That's my goal. The pathology of type 2 diabetes, the disease, is the pathology of hyperinsulinemia. In other words, the insulin level is up and causing the disease. I think you're starting to get the idea, but let's continue on the road. And if you're getting confused, you can see this in a few days on YouTube. YouTube, Kachmann, this show will be on there. Recent studies show 21% of patients have retinopathy, changes in the eye at the time of diagnosis of diabetes. So they've had it for a long time. That diagnosis has not been made. Remember, you can diagnose people on the road to diabetes by getting serum insulins. Recent studies show changes in the eye start to occur 7 years before a diagnosis of diabetes is made. If you had checked the serum insulin, you would have known about it, saw there was a higher number, and recommended prevention, stopping, reversing. A serum insulin test done at least yearly would have produced an earlier diagnosis. Remember what I said? And stimulated earlier treatment, prevention, stopping. The onset of diabetes probably occurs, let's listen to this, 12 years before the clinical diagnosis is made. You could catch people on the road and prevent all the diabetic complications. Remember, diabetes, 57 diseases can be prevented or reversed. Wow. Dr. Kraft, again referring to his book, said, "I'll be looking down upon you." I think we're talking about heaven. "For many years from above, for things will seriously change." I will bet you he's watching me right now. We now know how to diagnose, prevent the vascular disease from diabetes. Now I will teach you how to get rid of it once you got it. Remember I said, I would say 80% of my city is diabetic. They've been running the wrong tests. They've not been checking their serum insulins. Industry, the hospital system, they get a hold of us. We need to step up. The medical school moved right in front of the largest hospital system in sending their students to the hospitals to train them about disease. And what do you think the hospitals are doing? They're not teaching them to get serum insulins. I've been there. I've personally talked with them. A book called Simply Keto by Susan Ryan would give you the information. So buy a used copy, maybe on Amazon. A brand new book has a certain price, but if you ask for a used copy on Amazon, maybe $3 or $4. Yes. And they have a Kindle source there too that's even cheaper. I like you to have a book. So I think people can refer back to it. Susan will teach you how to start the ketogenic diet, which I think is a good way, a quick way to get rid of the disease. And step one, step on the scale and record your starting weight. Okay. All right. 90 years old, 135 pounds. How could that be, Rudy? Well, I'll teach you about it later. Eat 2 meals a day. That's the easiest way. And I'll teach you about that in a minute. Also, take a photo. It may help motivate you. Remember, even normal weight people can have diabetes. Yes. 30% of the normal weight people, 30% of the normal weight, I'm not diabetic, look at my weight, 30% actually have diabetes. They had the wrong test. They never had serum insulin, for example, and they would realize that's elevated, and they're diabetic. They are getting vascular disease. They're getting some of the 57 diseases diabetics get. Yes. So if you're thin, it's no guarantee you're healthy. You need to get a serum insulin. Remember, even normal weight can have diabetes. Get a serum insulin. Set your personalized macros in a keto calculator, if you want to know a little bit ketones, and I'll tell you how they're produced in a minute. You can test for ketones in your body, if you wish, with the glucose monitor and a ketone monitor all in one. They are indeed available. I didn't say you had to get it. But that's the most accurate. Healthy fats are beef, pork, dairy, butter, cheese, whipped cream, eggs as healthy fats and healthy proteins, tropical oils, avocado, coconut, olive. You should get some idea what are good foods. Most of us need an insulin reset. Remember, I said most of the people out there today, 70-80% are diabetic. So we need to reset our insulin. The silent nature of prediabetes, your body may be full of disease, but you don't have any symptoms. So that you could call it prediabetes. It's what makes it so dangerous, because you don't have any symptoms. Often no pain, no sudden illness, no visible sign that something is wrong. The progression happens so slowly until a blood test reveals that your sugar is borderline high, but listen to this, but at this stage presents an extraordinary opportunity, because your prediabetes, which could have been identified by an elevated serum insulin, is completely reversible. We need to take advantage of that, okay? Your pancreas is still working. It's still working. Research shows lifestyle intervention, improving diet, increasing activity, reducing stress, improve sleep, can lower progression of diabetes. Prediabetes is not a fixed condition. Your blood sugar isn't up yet. You need to listen to your body. the real causes of insulin resistance, the modern diet, constant glucose, overeating, frequent snacking, inactivity, muscle loss, chronic stress, poor sleep, hidden information, hormonal imbalances, genetics, family history, the combined effect. Let's face it, sugar is our cocaine. It makes us feel great, and we have to eat every day, so we're going to be exposed to it. It also makes our insulin increase. Sugar makes us feel great, and it's addictive. Incidentally, a good book to read is called Fork in the Road by Jan and David Unwin. I think the world's experts in nutrition. They're from England. I've personally met them, talked with them. They were both diabetic, and their diabetes is gone. They now travel throughout the world, 22 countries, I think, teaching people how to get over diabetes. And they look totally different. They were both diabetic. They were in the English system. And the patient walked in one day and said to them, "Dr. Unman, you don't know what you're talking about." But he didn't say, "Get out of here." He said, and he studied what they said, and he now is saving the English socialistic system a lot of money. So that's a good book to read, Fork in the Road. And in that book, they teach you how to get rid of the addiction with teachers, great websites. I highly recommend that book. Our taste buds for sugar are located in the mouth, the tongue, hard palate, soft palate, down the esophagus, to the stomach, to the pancreas and bowel. The sugar receptors are connected to the pleasure center in our brain. That's why we feel good. They're connected to it. The sugar comes from the sources of sugar. Okay. The sources: cane sugar, okay, sugar beets. When I used to live in Germany as a child, we always ate beets because we didn't have the sugar cane. And corn. Yes. And corn, not all corn, certain types of corn. The fat switch, when the insulin level is rising, because one is consuming sugary foods, the fat cells are tightly locked in by the insulin. This is being controlled by insulin and leptin. And leptin is also related to fat storage. The one with the key, though, insulin, I think you may be tired of hearing the word. When we're fasting, not eating, okay, experiencing or just not consuming sugar, the insulin level will drop. Remember I said I ate 2 meals a day. Actually, our body secretes about 5 hormones early in the morning and during the night that we don't need to eat breakfast. Breakfast, most important meal of the day? No. That was an invention of industry to make sure you would eat some food. Yes. Our brain secretes about 5 hormones in the morning. Our blood sugar is like that. I go play pickleball, and I don't eat till around 11. So I recommend to people an easier way really is to eat 16, 8. Fast 16 hours, eat 8 hours. So then I come home after pickleball and I eat around noon. I eat a healthy diet, okay, of good fats, protein, and again, in about around 5, 6. You don't have to be 100%. Just do it 80, 90% of the time. And that's maybe why I'm 90. 134, 135 pounds today. Feel great. Don't take any pills. Oh yeah, I take vitamin M. Music. I wake up in the morning. I have a list of songs I sing or dance to. When the sugar gets low enough, the fat cells open up, let out fatty acids, where they hook up with the protein albumin. They are then transported to the liver, where they're converted to ketones, a fat molecule smaller than sugar, but has more energy in it than sugar. Insulin controls the fat switch. Again, insulin at work. The beautiful thing is that when you are using ketones, remember the molecules that have a lot of energy in them. A good book to read there too is Susan Ryan, Simply Ketone. What I like about the book is that it explains the diet very well, what to eat, what not to eat. And she has recipes in there which are excellent, excellent. Tells you the amount of calories, the amount of fat, amount of carbohydrates. That's really a great book. I encourage you to read Susan Ryan's book. And if you follow that, it explains it in tremendous detail. You don't have to be overweight. She had been overweight and used it to lose weight and become healthy, but it works on normal weight people. Remember, 30% of the people that are normal weight are diabetic. You can use hers to get healthy. So when you are using ketones for energy, you don't feel hungry. It doesn't go up or down much, and you're better on ketones than on sugar. Remember, sugar is addictive. It's addictive. Insulin inhibits breakdown of fat, lipolysis. The breakdown and release of fat from the cells. When insulin gets sufficiently low, the negative stimulus is sufficiently intact and everything changes. It, like a switch, is thrown. Above the threshold, fat cells hold onto fat. Below it, they release their stored fat. Above the threshold, our bodies burn carbohydrates and store fat. I had mentioned it before already, but let's go into more detail. Fasting, not eating, is conscious abstinence from eating for health, religion. It's voluntary. As critical to the definition of being in the fasted state. This is not starvation. I repeat, fasting is conscious, voluntary. Normal weight people could fast 2 months, incidentally, and be alive. I don't want you to do that. There's a story of a person that weighed 500 pounds. I read about it. And he was still alive, not eating 1 year later. Don't. There's a better way. Eat the right food. I'm trying to get you to fast only 16 hours and then eat during an 8-hour period. That's Rudy's 16-8 is what I do. That's why maybe I weigh 135 pounds and I'm still alive. I don't know. One case maybe doesn't prove anything, but could be. This will be very efficient if you eat 65% good fats. Remember, there are bad fats and there are good fats. Omega-3 and omega-6. You need to learn the difference. It's some other TV shows. But if you're eating 65% good fats, 20% good proteins, 15% vegetables and fruits, you'll be healthy quickly. Yes. 2 meals a day, and you eat this way I just described, and you'll get rid of diabetes. Bang, doesn't take much. That's why I'm a little obsessive about that our medical system, our medical school, our hospital systems is not teaching this. And I think the reason they are not teaching this, the money. I'll save you a lot of money. You'll be on no pills. I'm on no pills. I just take vitamin M, music. If we don't eat for 12 hours, we start getting our energy from fat. Our sugar and glycogen, which is in the liver and in our muscles, has been used up in about 6 to 8 hours. And the mask hormone insulin has dropped severely. Our fat cells open up, let our fatty acids out. The fatty acids are picked up by the albumin in the blood. I may have mentioned this before. There's no harm in repeating it. And transported to the liver. could be converted to ketones. The brain, the liver, heart, kidneys use them for energy. The brain loves ketones. The brain loves ketones. Fasting has been bad for the fast food industry because we're getting rid of their diseases. If people followed what we spoke about today, the fast food restaurants might need to shut down. Remember, you eat sugary foods, drinks, the insulin level goes up, and it locks the door to the fat cells. But remember that even the thin people can be diabetic. So even if you're thin, I want to know your serum insulin, and blood sugar is fine. So insulin is your energy. It's anabolic, and it makes you fat. So I don't want you to need to consume it, but I would like for you to test for serum insulin at a very young age 2 or 3, which we're not doing it. And as Dr. Kraft said, he'd be looking down on us for many years before we change. And I would like to, before Dr. Kraft's book, I'd like to put this a minute, and then I'll read it to you. Okay, let me read it to you a little bit. Diabetes type 2 is a world disabler. Well, that's true. None of us would argue with that. Causes 57 diseases. 57. We could get rid of those. We could prevent those. Heart attacks, strokes, cancer. The good news is 95% is preventable and reversible. Thank you. Thank you. Many have diseases and don't know it. It's more common in overweight. 80% of overweight people are diabetic, but not all of them, but 80%. Also, 30% of the normal weight individuals. You have normal weight, I want to know your serum insulin, your blood sugar. There are certain races and cultures where these diseases are more common. It's not a racial comment, but we have to keep that in mind. It's more common in African Americans. Mm-hmm. It's not because they're black, because their history is different, genetics are different, but we need to do something about it. It's more common in African Americans, Hispanics, Asians, and Pacific Islanders. In some Pacific Islands, they are eating, and they used to be healthy, But then our sugary foods got to the island, and the whole island is eating the sugary foods, and they're all diabetic. There are islands out there in the west that they're all diabetic on this island. But we need to not let that happen. We need to teach them about this. Maybe get them to watch these TV shows. And listen to this. Serum insulin can be elevated 10 to 15 years before blood sugar increase. Remember, I told you that before. The insulin will cause changes in your body, but you don't have any symptoms. Disease is occurring. But what's beautiful about that, which I told you earlier on this show, is that before the diabetes occurs, all that elevation in diseases it was causing in your body, can be totally eliminated. You can be returned to a normal person. Wow, what an opportunity. The reason today 50% of heart attacks that occur in people, they just grab their chest and they die. And they were an example of the people who had disease and didn't know it. That information is out there. But the industry was making money. Don't want you to act on that. We doctors should be telling you that. But the medical school, why wanted to teach, did not allow that, and they moved in front of the hospital system, and the hospital system making money is teaching the medical school because their students are going to the hospital. No warning, people grab their chest and die again, having had no symptoms. So I to you, get tested. I want to know what your serum insulin is. And you start getting tested for HbA1c, average blood sugar, and a serum insulin starting at age 2 or 3. And then reverse their disease by teaching them proper nutrition. Let's face it, kids love sugar. We give them sugary food to make them feel happy and good. But we may be making them sick. And with that, and I would like for you, if you can, get a hold of this book by Joseph Kraft, Diabetes Epidemic in You. Should everyone be tested? Absolutely not. Only those concerned about their future. It's a fantastic book. You can get them Amazon used books. I like you to, because you can read it and it explains to you in detail what I've been talking about. But thank you for listening to this show. But you can see a great deal more of it on YouTube. Rudy Kachmann, Kachman, and I have there probably 1,000 TV shows. Thanks a lot. See you next time. Next time you see me, give me a hug, ask me a question, or play pickleball with me. I do this because I love you. Bye-bye.